Hi, have you ever had to evaluate the pectoralis and didn't know where to start? The pectoralis isn't a part of your standard shoulder ultrasound protocol, therefore, there's not a lot of resources out there on how to scan it. It's important to know the origin and insertions of muscles and tendons and how the fibers run to be able to align your transducer with it. Let's look at some images. For your pectoralis protocol, you should start with the pectoralis major muscle. It's the larger and more superficial of the pectoralis muscles. This is a panoramic view, and this is a nice feature on my system where you can do an extended field of view and then also do a zoomed in portion. The muscle originates in the medial chest at the clavicle, the sternum, and the ribs. The muscle fibers run horizontally until they transition into the pectoralis tendon. The tendon inserts onto the humerus bone of the arm, as you can see in this picture. The insertion of the pectoralis tendon is visualized in the long axis at the level of the humerus when scanning the long head of the biceps tendon in the short axis near the myotendinous junction. The pectoralis minor muscle is located deep to the pectoralis major muscle. It's smaller and thinner than the pectoralis major muscle is. It's going to be triangular in shape, and it also runs horizontally and has an oblique course. It originates in the medial chest from the ribs and runs laterally to insert onto the coracoid process of the scapula. Although the transducer will be in a transverse plane on the body, due to the direction of the muscle fibers, the pectoralis muscles should be scanned in the long axis from superior to inferior. Then you would turn your transducer 90 degrees and you would be in a sagittal plane on the body. But again, due to the direction of the muscle fibers, you would be scanning in the short axis from lateral to medial. I also want to mention that it's really helpful to have a graphic reference available to help understand the orientation of the muscle and tendon fibers so that you can properly align your transducer with them. Here's an example. In this example, there was a tear of the pectoralis major at the level of the myotendinous junction. As you can see, muscle tears can blend in with the normal tissue if the fluid is complex. So when something tears, it bleeds, and the fluid can be different echogenicities depending on the age of the injury. When a defect is suspected, a contralateral comparison to the normal side can be really useful to isolate any subtle abnormalities. The dual screen feature can be really useful to help this pop out. So on the left side of the screen, I'm pointing out the area of the hematoma from the muscle tear at the myotendinous junction. On the right side of the screen is comparing it to the normal tendon, so it makes it more obvious and stands out. This is a dual screen showing the long axis of the tear on the left side and the short axis of the tear on the right side. And then you also want to measure it in the long axis and also in the short axis. It's also useful when you have a tear in the muscle to show it relative to the tendon insertion. So if you ever had to measure the distance for a surgeon, this is a really useful picture. So the arrows are on the tendon and the injury is located more medially at the myotendinous junction. And as you saw throughout this example, you always want to use color Doppler to demonstrate any hyperemia present from active inflammation, which was present in this example. You always want to use the most sensitive color Doppler feature available on your system, which is often power Doppler. And the system I was using for this example actually has superb microvascular imaging, which is even more sensitive. Hope this helps you next time you have to scan a pectoralis.